Hi everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about a topic that is often taboo and really not discussed enough from the scientific perspective, in my opinion, and that might be just because I'm not well versed in it. We're going to be talking about marijuana use with regards to breastfeeding. So guys, in this video, we're actually going to be talking about marijuana, weed, pot, MJ, Mary Jane, all those different types of things that you have heard it be called before, but just generally what we know about using it during breastfeeding. Spoiler alert, not a ton, but we do have this latest study that we're going to be discussing and referring to. Generally, here's the thing that we do know. We know that use of cannabis has definitely increased in the last 20 years, and that includes among reproductive women. This is important because as it's become legalized, there has been this perception that it's not as risky. And really, there's no way to prove that because there's a few confounding factors. First off, it's become more potent. So in the last 10 years, definitely the potency, the strength of marijuana has increased. So in other words, it's not your grandma's weed. The second thing is there's often concomitant use of other substances, whether it be cocaine, whether it be cigarette use. So it's really hard to know when the symptoms are put together, is it just marijuana or is it other confounding substances used as well? Lastly, there are different types of cannabis, and we're going to talk a little bit about that. Now, when it comes to cannabis and the different forms, first off, let's talk about phytocannabinoids. And like the name alludes, it's derived from a plant called Cannabis sativa. Now, up to 125 different cannabinoids have been identified from this plant, including THC and CBD, the most common ones that we often hear about. Now, when it comes to THC, it's very common for it to be alluded to for its psychoactive effects. So those are the mood changes that we might be hearing about. But when it comes to CBD, this is commonly touted, and I will say I am not an expert in this field, so I can't say that I would endorse or use these at any time for any symptoms because I'm not comfortable prescribing it or recommending it. But when it comes to CBD, this is often thought to not have psychoactive effects, but instead be useful for analgesia or pain control, spasms or antispasmodic or anti-inflammatory. Again, not my recommendation to use it, but it's important to know because those are the two common ones that you're going to see recommended when it comes to medical care. Otherwise, there are such a thing called endocannabinoids, and these are receptors found within the human body. Lastly, synthetic cannabinoids. Now, these are manufactured kind of as designer drugs that then bind to cannabinoid receptors in the body. We're not going to really focus on the last one, those synthetic cannabinoids in this study, but again, it's important to discuss this because we do know that women are using this more. And generally, in some marijuana dispensaries, it's actually recommended to use marijuana for even first trimester nausea. And this is, again, not my endorsement, but important to understand that it is being used more commonly amongst reproductive women, pregnant women, and lactating women. And again, as I mentioned, the potency is increased with the perception of risk and any risk associated with it really decreasing or being normalized. And as a pediatrician, that's obviously not cool to me because there are risks to the baby. Low birth weight, preterm delivery, NICU admissions, there's an effect on verbal skills, on attention span, and even on short-term memory. And that's just what we think we know. And again, it's hard because there's oftentimes concomitant substance use, which can really muddle the picture. All right, let's talk about this study generally. When it comes to lactating women using marijuana. What we knew before this is several studies have indicated that marijuana use does definitely result in cannabinoids and their metabolites being present in breast milk. It makes sense because it's stored in fatty tissue or adipose tissue, and breast tissue has a lot of adipose in it. Not only are the cannabinoids then found in the breast tissue, they're actually excreted into the breast milk. Now, this study seems to indicate that there could also be a change in the profile of the breast milk because those cannabinoids bind receptors in the human body, right? We talked about the endocannabinoid system within the human body a little bit earlier. So not only will they bind it, but they can cause compositions and changes in the profile of the breast milk. And that's really interesting, but also important to know. Things that are a little bit more confounding and not really clear from this study. Was fore milk used? Was hind milk used? What was the composition of the breast milk potentially before marijuana use? Obviously, there's variability in breast milk profiles, right? The amount of fats, the amount of proteins from woman to woman, or from lactating individual to lactating individual. But what time of day was the milk obtained? When was the last feed? When was the last time marijuana was used? In what form was it used? Those are all really important questions that didn't really come into play when discussing the sampling, the milk, and just generally how it was obtained. And it matters because when it comes to science and making definitive conclusions, we need to understand all these different variables. For example, the appearance of a cannabinoid in the bloodstream really varies on how it was used and when it was used. So THC is going to be detected a lot quicker when inhaled versus ingested. So when you smoke it versus when you eat. And I think that's really important to know, especially if we're going to look at sample sizes of lactating women who use marijuana or cannabis. There's also going to be variability on depth of inhalation, the length of the breath hold, and puff duration. So things that we have to consider when we're studying cannabis and cannabis use. Now, one thing that's important to know that we briefly touched on is that the metabolites of marijuana or cannabis use can actually affect the endocannabinoid system within the human body. Specifically, we said it can affect the milk, fatty acid profile, and protein synthesis. But it can also have an effect on dopamine receptors. Now, when it comes to the human body, there is definitely a physiologic and homeostatic balance. So when something increases, another thing decreases, and that's how the body is able to regulate things like body temperature or hormones. So, for example, if you're going to have an increase in dopamine, then our body naturally will decrease prolactin. And if you've seen any of my other videos on how breastfeeding works and the surges in hormones, then you know that prolactin is associated with not only a supply, but it's produced during pregnancy. So if you're having an increase in dopamine, then your body is naturally going to decrease prolactin. And that actually corresponds really nicely to what we saw in this study. So in this study, the group of women who used cannabis self-reported lower supplies of milk produced. Now again, it's important to note that concomitantly cigarette use can also have an effect on milk supply. So we have to consider that and take away everything, any conclusion formed with that grain of salt. But as a mom who has nursed twice, as an IBCLC, as a pediatrician, I know that in the first 6 months, women are very likely to be discouraged and want to stop nursing, especially if they're combating issues like low supply. So what we understand at this point is marijuana is absolutely not necessarily helping the milk supply and may actually be hindering it. More important takeaway is this is definitely something that needs to be studied more and something that we will hopefully be able to find out more about when it comes to guiding women's health, but just generally the health of lactating individuals and the infants who ingest this milk. I hope this was helpful. I definitely got a lot of information out of it when I read through this study. We can link the study down below. If this video was helpful, make sure you give it a thumbs up. If you have any questions, please leave them below in the comments and I'll try to get to them and answer them the best I can because as you know, this is a topic we are all still learning about.